Picture this. You're cruising down the highway in your car. Would you rather have a system that's constantly monitoring the engine, gently tweaking the oil pressure and temperature to keep things running smoothly? Or would you rather just wait until the check engine light is glaring red, smoke is pouring out from under the hood, and the whole engine is totally blown before you do anything about it? Sounds crazy when we talk about our cars, right? But for the longest time, that second scenario is exactly how we've treated the human body. So what if medicine actually focused on creating health from the ground up, instead of just reacting to disease once the damage is already done? Right now, we've basically got two playbooks for human health. On one side, there's our current standard, modern reactive medicine. Don't get me wrong, it's an absolute miracle for acute trauma and emergencies, but it tends to treat organs in total isolation and relies heavily on polypharmacy. You know that cycle of taking multiple medications just to manage the side effects of other medications? On the flip side, we have integrated proactive medicine. This playbook anticipates risk. It looks at the whole person, and it seamlessly integrates lifestyle factors to actually build up your lasting resilience. Welcome to The Explainer. Today, we're unpacking the really fascinating science behind how choosing to integrate modern medicine with evidence-based complementary therapies can completely alter your biological trajectory. We're going to see how shifting from a fragmented, disease-centered model to a whole-person systems-based framework isn't just a nice, feel-good idea. It is scientifically proven to improve patient outcomes. Here's a quick look at our roadmap. We're going to start broad with the limits of our current system, then sketch out the integrated blueprint. Dive into some cutting-edge anticipatory AI, zoom all the way down to your cells, and finally bring it back to real-world patient experiences. Let's jump in. First up, the limits of reactive medicine. Why exactly is our current standard of care hitting a breaking point? Look, if you break your leg or have a heart attack, modern medicine is unparalleled. You want that ER doctor. But it really struggles with chronic, lifestyle-driven diseases. The conventional model is just so fragmented. You see one specialist for your heart, a totally different one for your digestion, and someone else for your joints. It creates this massive medication burden and treatment intolerance, and ultimately it can lead to progressive end organ damage, simply because it ignores the reality that our biological systems are deeply interconnected. Moving right along to part 2, the integrated healthcare blueprint. If the reactive model has hit a wall, what's the fix? What happens when we bring the best of both worlds together? We can beautifully map out a patient journey that takes the incredible, high-tech diagnostic power of Western medicine and pairs it with the holistic, resilience-building practices of Eastern and traditional systems, things like Ayurveda, yoga, and mind-body medicine. It absolutely doesn't reject modern science. It completes it. And just to be super clear here, we are not talking about using alternative medicine to replace conventional care. Integrative medicine is the intentional, evidence-informed combination of both. It keeps modern diagnostics and pharmacology as your solid foundation, but brings in complementary interventions as adjunctive, supportive strategies to really optimize your whole person health. It's honestly a perfect partnership. While modern medicine excels at high-precision diagnostics and keeping you alive in an emergency, integrated medicine steps in for functional assessment, supportive recovery, and what we call dose sparing. That means using complementary therapies to actually reduce the amount of heavy pharmaceuticals you need, which naturally mitigates side effects and preserves your long-term organ function. All right, on to part 3. This is where it gets incredibly cool. Anticipatory AI and early detection. The ultimate biological check engine light. Remember that blown car engine? Well, instead of waiting for a formal clinical diagnosis, when the smoke is already pouring out, anticipatory AI tracks your physiological data 24/7. It figures out your healthy baseline and actively looks for the earliest possible deviations on this timeline. This is a total game changer. It shifts us from reactive treatment to proactive health recovery, letting health navigators step in with personalized lifestyle tweaks long before an acute disease ever sets in. And the AI isn't just guessing. It is constantly synthesizing subtle digital and physiological markers. We're talking about a slow decline in your daily steps, slight sleep disturbances, creeping stress hormones, or an increasing waistline. By pulling all these interconnected data streams together, AI acts like an early warning radar, flagging metabolic deterioration literally years before you'd ever need a hospital bed. Which brings us to section 4, healing at the cellular level. How do these early interventions actually physically heal your body? Let's zoom way down to the microscopic level. The big secret about chronic diseases, whether it's heart disease, type 2 diabetes, or even depression, is that they do not start in a vacuum. They share a common biological root, systemic inflammation. Now, this isn't the acute, localized swelling you get from a paper cut. This is a persistent, low-grade state of immune imbalance that actually accelerates biological aging and constantly disrupts your body's networks. And this is exactly where integrated practices shine. Take a complementary practice like therapeutic yoga. We aren't just talking about feeling a bit more relaxed after stretching. These practices directly interact with your central nervous system to biologically rebalance your immune system, literally turning down the dial on that chronic systemic inflammation. The biochemical shifts here are frankly mind-blowing. When you utilize integrated care, we can measurably see a drop in stress hormones like cortisol and inflammatory markers like CRP. At the exact same time, these interventions upregulate your body's own internal antioxidant defenses, things like glutathione. You are literally protecting your cells from oxidative stress and changing your genetic expression just through targeted lifestyle choices. We see this targeted action with nutrition too. Specific, evidence-backed Ayurvedic interventions can directly target those exact inflammatory pathways. For conditions ranging from hypertension all the way to irritable bowel syndrome, these adjunctive treatments act as precise molecular communication, actively preserving your organ function over time. Finally, Section 5, Transforming the Patient Experience. We've seen the cellular science, but let's zoom back out. What does this mean for your actual lived experience? Take a second and look at this number. 92%. That is the staggering percentage of patients with chronic diseases who actively want their doctors to talk to them about complementary therapy options. People are absolutely demanding holistic care and shared decision-making. And when patients actually receive this integrated care, healing the body through those interconnected cellular, molecular, and whole body systems we just talked about, the outcomes are phenomenal. People feel better, so we see a massive improvement in adherence to treatments. We see vastly better self-management. We're catching things earlier, seeing dramatically fewer clinical complications, and significantly enhancing resilience. All of this combines to deliver the one thing that matters most: a substantially better quality of life. Naturally, when individuals are doing better, the whole healthcare system breathes a sigh of relief. Patient satisfaction goes through the roof because people finally feel treated as complete human beings. This shift brings a huge potential reduction in overall healthcare utilization. We're talking fewer stressful emergency room admissions, reduced medication side effects, and, crucially, long-term organ function that is actually preserved. It elevates the standard of care while making the whole system more sustainable. There's a brilliant quote from Professor Rajiv Gupta that really hits the nail on the head. He explains that by intentionally combining the precision of modern science with function-restoring holistic practices, we finally move away from that fragmented, disease-centered model. We move toward a future of healthcare that is entirely focused on preserving your function, your organs, and your life. So here is the big question to leave you with. We've seen how integrating these incredible systems can heal the body from the tiniest inflammatory molecule all the way up to your day-to-day happiness. They say your genes might load the gun, but your lifestyle and environment, they pull the trigger. Knowing this, what steps are you going to take today to step out of the reactive cycle, integrate your care, and become the active architect of your own health?